Hi, this is Dr. Angelique Millette, and I'm going to be talking about one of my favorite topics. It's called Parentese. Parentese. Have you heard of Parentese? So Parentese is something that you're probably doing with your babies and your toddlers. It would sound a little bit like this. Let's say that you're talking to your baby about putting your baby down into the crib. You might hold your baby and look in your baby's eyes and say, "Oh, I'm going to put you in your crib. Your body's safe. Your body knows just how to sleep." You might say something very sweet like that, like where you're talking to your baby and explaining something that you're doing with them. And with a toddler, Parentese would look like something like this, where you might talk to your toddler about, say, ending playtime, maybe starting lunch or dinner. Usually be around a ritual or routine where they're disagreeable and they might have some resistance. You might say, "Hey, body, is it time to put away our toys? Oh, little hand, time to put away the toys. We're going to have some lunch. We're going to use this hand to hold our fork and eat lunch." And we might talk to the hand and say, "Time to say goodbye to the toys. Time to have lunch soon." So if you think of Parentese, it's a way that parents can transition their kids from one activity to the next. And we have all kinds of applications. We use it with babies as well as toddlers and young kids. One of the places that we really like to use it is around sleep issues. And so I'm going to share with you one really simple activity that we use Parentese for. And it's around helping a child learn to separate from a parent at sleep time. So it works like this. You're going to sit with your child. You would do this during the daytime, outside of sleep time. So it would just be a bonding activity that you would do with your child for about 5 minutes or so. You want to be sure that you're doing it when there's not distractions, there's not something else going on. It's just you and your child focused and playing. And you're going to talk to your story and talk to your child and tell them the story about sleep time. So you'll look at your child and say, "You know how you've been having a hard time sleeping sometimes at bedtime? You're feeling so sad. Your eyes are sad and your heart's sad, and you don't want to say night night at all. You want to keep playing with mama or with daddy at bedtime, and you don't want to say nighty night. Now we're going to help your body get ready to go to sleep, and we're going to help your body say goodnight to mommy and daddy." And then you're going to actually say goodnight. You're going to practice saying it. So you're going to say, "This is how we say goodnight to our body. Good night, eyes. Good night, mouth. Good night, arms. Good night, legs. Good night, body. Time to go to sleep." And you can actually do a little waving good night. And as you're doing the waving, you can even drop your voice and have it go a little quieter and a little quieter as you're doing the Parentese. So think of Parentese as a tool in your parenting toolbox where you use storytelling, you'll use some language, you'll change your inflection, you'll change your tone, your pitch of your voice. It might be more sing-songy. It can be more slow and quiet and sleepy. But you're really using your body, your hands, your visual cues, your voice to really communicate something to your child about their behavior or about a change in their schedule. And you can really use Parentese for all kinds of transitions and changes in your child's life. We use it for not just sleep, but behavioral changes. If we're getting a child ready for a trip or for parents going away, we'll use it for that. All kinds of big changes that a child is going through. So check out the article that we have in our monthly newsletter about Parentese, and be sure to check out upcoming features describing all kinds of topics related to sleep and parent coaching. Thanks so much for your time. This is Dr. Angelique Millette.